Hey guys, Aaron Farmer here with MySugarFreeJourney.com, and we are going to take a look at all of the cool stuff that has come across my desk in the last day or two. Some interesting articles. So number one, we're going to take a look at this one. I talked about a similar study that was done. I talked about it last week, or maybe 2 weeks ago. This is a different study, but looking at the same thing. A low carbohydrate, high fat diet initiated promptly after diagnosis provides clinical remission in 3 patients with type 1 diabetes. So as we go through this, I want you to keep that in mind. We're talking about type 1 diabetics, not type 2, not people who've blown out their their pancreas because they were too fat. These are people who had an autoimmune issue and developed type 1 diabetes. So patient number 1, I won't go through all the stuff that he presented with. The big thing here is he commenced multiple daily injections of insulin after he was diagnosed with type 1 diabetes. 1 month after diagnosis, he took the initiative to start an LCHF diet with an average daily intake of 50 grams of carbohydrates. He was able to stop insulin completely 15 days later and has not used insulin since March of 2015. So I want to read that again. Diagnosed with type 1 diabetes in January of 2015, went on a low-carb diet a few weeks later, has not taken insulin since then. Type 1 diabetic that does not have to take insulin because of their diet. Patient B was diagnosed in November of 2017. 2 months after diagnosis, he took the initiative to follow an LCHF diet. And again, I want to also point out that none of these cases was a low-carb diet suggested to them by the doctor or prescribed to them. They went on their own initiative and did this. He stopped insulin therapy at the beginning of the diet and has not used insulin since, except for one infectious episode. Plasma C-peptide was not measured at the time of diagnosis. But let's see, there's something else I wanted to share. 3 months after initiating the LCHF diet, his LDL-C was 164 milligrams. At 1 year after the diagnosis, he had no diabetes-related complications. He has started exercising 2 times a week for about 1 to 2 hours before the diagnosis. So he even started an exercise program before being diagnosed with type 1 diabetes. Went on an LCHF diet, has not had to use insulin. Patient C was diagnosed with type 1 in May of 2015. Blah, blah, blah. Let's go here. Multiple daily injections of insulin were started, and 9 months later, so he was on daily injections of insulin for 9 months before he started the low-carb diet. He, including an average intake of 20 to 30 grams a day of carbohydrates. 2 weeks after commencing this diet, he was able to stop the insulin therapy. 2 weeks. That's what it took. He was a type 1 diabetic for 9 months, stopped eating carbs, and after 2 weeks, stopped using insulin. He has not used insulin for 18 months. In December 2017, he had to resume insulin therapy to maintain capillary glycemia at 80 to 100 milligrams. Plasma LDL-C and high-density lipoprotein cholesterol levels increased with implementation of the LCHF diet, while plasma triglyceride levels decreased. He reported no diabetes-related complications at 1 year after being diagnosed. After diagnosis, he started exercising once or twice a week for about 1 to 2 hours each time. So these are 3 patients, 2 of which stopped using insulin completely. The third one dramatically decreased the amount of insulin that they were using. And again, type 1 diabetics, not type 2. Let's move on. Reduced carbohydrate intake improves type 2 diabetics' ability to regulate blood sugar. Patients with type 2 diabetes improve their ability to regulate blood sugar levels if they eat food with a reduced carbohydrate content and an increased share of protein and fat. We kind of know this stuff, but it's this sentence right here that I want to highlight. The findings are contrary to the conventional dietary recommendations for type 2 diabetics. So people that go on a low-carb diet are doing it in opposition to the conventional dietary recommendations, and they are able to control their blood sugar much better because of their low-carb diet. A central aspect in the treatment of type 2 diabetes is the patient's ability to regulate their blood sugar levels, and new research now indicates that a diet with reduced carbohydrate content and an increased share of protein and fat improves the patient's ability to regulate his or her blood sugar levels compared with the conventional dietary recommendations. In addition, it reduces liver fat content and has a beneficial effect on fat fat metabolism in type 2 diabetics. So a low-carb diet is good for type 1 diabetics. It's good for type 2 diabetics. Is there anyone that it's not good for? Well, we'll look at one possibility here in a minute. This was interesting. Food insecurity common among U.S. higher education campuses. So these are college students. Many universities and college students across the U.S. report lacking access to a reliable supply of nutritious food, a concept known as food insecurity, which can affect their ability to learn, according to research presented at the annual convention of the American Psychological Association. And this is a quote: food insecure students were more likely to fail assignments and exams, withdraw from classes or the university, and had lower grade point averages than their counterparts. Additionally, they reported missing out on professional development opportunities such as internships, which may affect their future career ambitions. That's terrible. No one should be, food insecure. There should be enough food for everyone. So what did one university do in London? This is Goldsmiths University. They've decided to ban beef to tackle climate change. So all these college students who are most susceptible to things like food insecurity, they're going to remove the most nutritious food substance in the world from their college campuses. They're going to make it more and more difficult for these poor college students to get their hands on good, high quality, and nutritious food that will fill them up and require them to consume less calories. The Southeast London University will remove all beef products from sale at campus food outlets by September as part of its pledge to become carbon neutral by 2025. Of course, we know that this is a lie, that if you would like to reduce your carbon footprint, what you need to do is you need to stop buying grains. These big, huge monocrops are responsible for more carbon going into the atmosphere than a typical, let me make sure I say this right, than a typical grass-fed beef, pasture-raised cows. If you're comparing this to a feedlot, they're probably about the same. But if you are actually concerned with putting carbon back into the soil, creating topsoil, reducing greenhouse gas emissions, you want to buy your meat. Make sure it's been pasture raised, and make sure those cows have the ability to poop on the ground, on the grass, and not in big pools like you would see in a feedlot. But that's how you reduce carbon emissions, not by banning beef, but stop eating grains. That's what's going to kill you. That's what's killing the planet. It's these huge monocrops. That's what does the damage. Moving on, ketogenic diet in the treatment of cancer. Where do we stand? The ketogenic diet probably creates an unfavorable metabolic environment for cancer cells and thus can be regarded as a promising adjuvant to a patient-specific multifactorial therapy. So I want to make sure that we're clear on this. I'm not saying that if you have cancer, you should go on a ketogenic diet and not do anything else. And that's not what this paper is saying at all. But it appears to be safe and it appears to make the environment of your body less beneficial to your cancer cells. So if you have cancer, go on a ketogenic diet and then continue to do all the stuff that your doctor says, but a ketogenic diet isn't going to hurt you and it will probably help you. The majority of preclinical and several clinical studies argue for the use of a ketogenic diet in combination with standard therapies based on its potential to enhance the anti-tumor effects of classic chemo and radiotherapy, its overall good safety and tolerability, and increase in quality of life. However, to further elucidate the mechanics of the ketogenic diet as a therapy and evaluate its application in clinical practice, more molecular studies as well as uniformly controlled clinical studies are needed. You're going to see this disclaimer at the bottom of every one of these studies. More studies needed, more studies needed, more studies needed. And I don't have any problem with saying that more study is needed, but what I do have a problem with is people refusing to do something that will probably help them based on the fact that not all of the studies are done. There's never going to be a time when all of the studies are going to be done. If you have cancer, go on a ketogenic diet. Continue to do all the stuff that your doctor says to do, but add the ketogenic diet as a normal, as an adjunct, basically, to what your doctors are telling you to do. It's not going to hurt you, and it will probably help you. Next up, I thought this was very interesting, and I couldn't get more information than this. The ketogenic diet and its effect on bone mineral density. During long-term follow-up of children treated with a ketogenic diet therapy have an increased incidence of bone fractures. However, the exact contribution of ketogenic diet therapy to a decreased bone mineral density remains unclear. I'm going to follow up on this. I couldn't find any more information. These are kids that were in long-term care, that were fed a ketogenic diet, and their bone mineral density appeared to go down, and they had increased rates of bone fracture. My guess is that the ketogenic diet that they were put on was something from a shake that was probably 90% oil, that didn't have the necessary vitamins and minerals. I'm thinking primarily of like vitamin K. Vitamin K is what is used by your body to move calcium out of your diet and into your bones. So for something that they're doing is making the bones of these children more fragile. I don't know what it is. I would love to get a list of what these kids are eating, but I can almost guarantee you it's not real food keto. And I've never seen an instance where somebody's bone mineral density went down as a result of eating real food, a real food ketogenic diet. But I wanted to point that out. Okay. Low LDL means higher hemorrhagic stroke risk. More evidence supports the link between low density lipoprotein, that's your LDL cholesterol, and an increased risk of intracerebral hemorrhage. Results from a large prospective longitudinal study show individuals with LDL below 70 milligrams per deciliter had a 65% increased likelihood of ICH over 9 years. So, I mean, that's where they want you to be. That's how low they want your LDL to be. Furthermore, the participants with LDL below 50, so these are people who are really driving down their LDL, probably with the use of some really hefty statin drugs, had 169% increased greater risk compared with their counterparts who had levels in the 70 to 99 milligram per deciliter range. So if you follow your doctor's advice and power your LDL cholesterol low, you might not drop dead of a heart attack, but your brain might explode. That's terrible. And again, I want to be very clear. Every time we talk about LDL cholesterol is not the problem. LDL cholesterol can be beneficial. I think at worst it's neutral. What's dangerous is glycation and inflammation. If you're concerned about dropping dead of a heart attack, or if your brain exploding with a hemorrhagic stroke, or something else that you're concerned about, don't worry about your LDL cholesterol primarily. First, worry about your average blood sugar, and worry about your levels of inflammation. There's several tests that you can run to look at your average inflammation, but your HbA1c for your average blood sugar levels. These are tests that you can look at, and they're really easy to order from your doctor. They're pretty cheap. If you are concerned about these things, it's not a statin that you should be taking. You shouldn't be driving your LDL cholesterol levels low in absence of these other factors. You should be driving your blood sugar levels low. You should be driving your levels of inflammation low. You should be driving your stress levels lower. Those are the things that more contribute to things like heart attacks or hemorrhagic strokes, or all of these other diseases that just can kill you at the drop of a hat. That's what you need to be concerned with. Get your blood sugar levels low, okay? Stop eating sugar. Stop eating grains. Stop eating food that didn't exist, 200 years ago, or especially in the levels that we're eating them today. Stop eating polyunsaturated fats. Eat lots of red meat. Eat lots of meat in general. Some leafy greens if you want them. Lots of eggs. And eat real food. Eat real food, and you'll see your risk of a lot of these diseases drop. Okay, guys, if you've made it this far into the video, do me a couple favors. Number one, subscribe to the YouTube channel if you're watching this on YouTube. If you're watching this on Instagram, then like the Instagram page. Follow me there. I love when you guys do that. But most importantly, leave a comment. I love hearing from you guys. And if you think that I said something wrong, there's a possibility you're not wrong. Sometimes I stumble over my words when I do these videos because I'm not really thinking in advance of what I want to say. But if I said something wrong, say something in the comments. I'd love to hear from you guys. And I guess that's it. I appreciate you guys watching, and we will talk to you next time. Bye-bye.